All right. Actually, we'll get started with the land acknowledgement. Would anyone like to read the land acknowledgement for us today?
I can go ahead and do it.
Thank you.
Okay. We recognize and acknowledge the indigenous land on which we live, work, learn, play, and grow. This is the land of the Warm Springs Wasco, Northern Paiute, Tenino, Klamath, Molalla, and Yahuskin. We acknowledge them as the past, present, and future caretakers of this land. It is on their traditional land where we partner to improve the health and well-being of Central Oregonians. We aspire to be good guests, honoring the concept in the Warm Springs culture. This land is for you to know and live upon and pass on to the children.
Let's go over our meeting practices. Didn't realize I was on mute. Hey, Brad, I see your face. Are you?
Can you hear me?
Yes, we can.
I had to jump onto my laptop. I'm not sure why our desktop's not working, but anyhow, hey everybody. Thanks for getting us started, Michaela.
Yeah.
And thank you, Myra, for reading the land acknowledgement.
You're welcome.
So what we're looking at right now is our agreement to make our meetings warm and welcoming for everyone. And some of the ways we have agreed to do that is by making the meetings less formal, so not using, trying not to use lingo and acronyms and all those things that some of us have a tendency to do. Using plain language, giving everybody the opportunity to speak, and doing our best to be proactive about asking you to, if you'd like to speak, as opposed to just waiting. And I hope everybody will be a part of that. Encouraging others to speak and speaking when you would like to. So let's go ahead and do one of the other agreements we have is to only have introductions for CAC members. You didn't do introductions, did you, Michaela?
No, not yet.
Okay. And any guests or folks that are not normally a part of this meeting who are not CAC members. So I'm going to ask either Kelly or Michaela to help with this.
Yeah, I've got this. So Brad and then Elizabeth.
Hi, everyone. Brad Porterfield. I'm the chair of the CAC, director at the Latino Community Association, and also a Health Council board member.
Hi, I'm Elizabeth Schmidt. I'm the vice chair of the CAC and retired voc rehab counselor.
Connor and then Tom.
Hey everyone, Connor Carlson. I work for Family Resource Center, live here in Bend, and I am a consumer rep.
Hi, I'm Tom Kuhn, Deschutes County rep. I had some dental work done this morning, so the left side of my face is paralyzed basically. So please know that this is due to anesthesia.
Maida and Miranda.
Hi, everybody. My name is Maida Benitez. I am with Family Resource Center and also a consumer rep for the CAC.
Good afternoon, everyone. My name is Miranda Hill and I represent Klamath County. I'm here with the health department. And as you guys can see, I look like I'm kind of in a wave. Something's going on with my camera too. So thanks.
Okay, welcome everyone. That is all we have for today.
So no guests or people who aren't normally with us.
No.
So for some reason, I'm not recognizing Martha Edwards. Who's Martha Edwards? Who are you, Martha Edwards? Not sure why I don't recognize your name, but. Are you there? Oh, maybe somebody else can help me out.
Martha is from Pacific Source. She did our health equity update last month.
Okay, thanks.
Health equity strategist.
Health equity strategist, all right. Public comment. Is there any public comment or any stories anybody wants to share? Patient stories? Well, I am going to ask Myra if you're willing to talk about the meeting that we had with community members on was it last Thursday?
Yes, it was. I'd be more than happy to. I also did have, I didn't want to be the only one, but I did have a consumer story. This is a positive one. Went over to get my daughter in for her physical of the year so she can do sports. Her primary doctor was not available to do appointments for another couple of weeks. So they asked if we would be okay going to the health-based center and seeing somebody the week of, which I happily opted and said yes. We went over there. Dr. Dwayne Carpenter is extremely nice. He did not make us feel like we were at a doctor's office, and made my daughter feel very comfortable. Started talking about, what she's going to be doing for sports and the reason why they do physical, and going over our family history. There are some illnesses in my family history that would be of concern when you're doing sports. And my daughter's comment was, we got the bad genes from my mom. We're all going to die. And the doctor was very professional, but explained it to her to a child's level of, doesn't mean you're going to die. Doesn't mean that you have the bad genes. That just means that it is up to you right now to take care of yourself and your body. So when you become an adult, you're not at higher risk of getting, those illnesses. But it doesn't mean that you're going to die. So we spend, I want to say, a good actual 45 minutes with the doctor, explaining things to my daughter and really making her feel comfortable in the importance of, keeping your health in good state and being active. And I have to say, I really enjoyed that. Usually you go in there, you wait 25 minutes before the doctor comes in after you've already been seen by the medical support. And then like within 15 minutes or less, you're already done and out. And I felt like we were actually the 45 minutes. It was face-to-face contact, and it was a lot of very important information, health information that was delivered to my daughter. And she had a little bit of a better understanding of everything. So I really appreciated that. Oh, and now moving into, sorry, Brad, forgot. Moving into meeting. Brad hosted a meeting for our Spanish-speaking community members in Madras. And we started off with, I want to say maybe 4 people. And then by the end of the meeting, we had about 15 people that came in and were talking about positive experiences and maybe not so positive, struggles, challenges that they have experienced while accessing care. We had a variety of diverse experiences. We had a family that had moved currently from New Jersey into Jefferson County, Culver, and they have been very pleased with accessing healthcare right away, and the service that they have received, it is great, great quality right away. Interpreters in their language, which is something that I was surprised that they did not have in New Jersey, because I think it's a little more diverse over there and there's a lot more of that population, but they did not have interpreters. You would have to bring in somebody that spoke your language. So that was very interesting to hear. Then we had other members that weren't really aware of the resources that are available to them. And so for them, it was like, well, there are no resources for members that have disabilities or certain needs, which Brad and I know there are because we're involved in all of this, but the fact that they did not know about those services was a little shocking, and a language barrier would be another thing. But most of them did speak on being very grateful that there are interpreters that are available to them and providers that are, some of them, few of them are Spanish speaking. And so they feel very comfortable when they go in for services. And so we had a great meeting. Like I said, some of them, did experience challenges into getting into appointments, accessing appointments, accessing resources that are available just because they're not readily available or they know about them. But other than that, I think it was a good meeting. Am I missing anything else, Brad?
Thanks, Mary. I would just add a couple things. One is that, I don't want to generalize and say that it's always the case, but the way that this meeting went, as Myra kind of alluded to in the beginning, we had folks kind of drifting in over about, the first 20 minutes from the start time. There was the couple from New Jersey was there early, and then a couple people were there like right on time, and then the majority were there like 5 minutes later, 15 minutes later, maybe 20 minutes later. So, there's just that being aware and being open and understanding in that meeting environment and not giving people grief about showing up late and just, welcoming them and is really important. So that's just something I wanted to share. And then there was a woman and her son who came toward the end, and the son was a Golden Glove boxing champion in Madras, about to become, I guess. He was a very successful boxer. And he had an accident. I don't know the details of his accident. The mother, they didn't get into it, but she had quite a few complaints about the care for her son over the years. And it would be, you'd have to sit down and really have a conversation to understand what all that was. But she mentioned the word, or at least I wrote down the word negligencia. So, I'm glad we have a positive story from Myra, and then we have also positive story from some of the participants in this group, but there was also negative stories. And then there was another, I think it was a senior, you might be able to help me remember, Myra, but we talked about cataracts and something with their hearing and that they haven't been able to access that care.
Yes.
And I don't remember if it's because they're on OHP and OHP doesn't cover it, or if it's Medicare and Medicare doesn't cover it. Do you remember, Myra?
Yes, so both of these are seniors and they both have Medicare and then they also have Oregon Health Plan. So for them, it was very confusing because they would show up to their doctor's appointment, give them Medicare and they're like, nope, we don't take that. They'd give the Oregon Health Plan, nope, Oregon Health Plan doesn't cover that. And so they felt like they were getting kind of like the runaround and they really didn't understand what Medicare covered, especially when you have A, B, and C, and and the D, like what are all those letters and meanings. But yes, it was the confusion of who covers what and when do I use this and when do I use that, and then if somebody doesn't cover it, how come the other one doesn't cover it, and really having to pursue and push on, okay, Oregon Health Plan is not covering or Medicare is not covering, why are you not covering?
Yeah, thanks, Myra. Yeah, it was kind of, I don't know if it was funny, but it was, they're pulling out all their cards and kind of showing their cards to each other. And this is a green one, and this one's a red one, and this one's a.
They referred to the Medicare as the blue and red card. You have to use your blue and red card or the one with the stars. That's how they refer to it. The star card. That's the one you have to use for this. And then, then it's your white card, which is Oregon Health Plan card for something else. So yeah, they were all comparing cards.
But I think it was really powerful to, we worry a lot about confidentiality, but often, families, they don't care that much if they feel comfortable and welcome, and, they get to share what they're willing to share and comfortable sharing. And so it's really powerful. So we look forward to doing some more of these. Let's move on to our approval of the notes from our March meeting.
Brad, can I ask a question?
Oh, yeah,
before-
yeah.
What were some of the services or resources that folks didn't know about? Was there-
Some of them were like early intervention resources. Then others were resources for kids who have either Down syndrome or like autism.
Okay.
Yeah, that's a family we definitely want to get back to, because I don't know if you had a chance. I had to leave a little bit early, Myra, if you had a chance to connect with them or not, but we did some work back with Oregon Health Sciences University, meeting with our Latino families with kids with special needs. And most of them had really good experiences. I take that back. They had really good things to say about OHP covering so much, but they kind of had not so great experiences here in Central Oregon, great experiences in Portland.
Mhm.
So we need to follow up with that family. And I'll try to remember to get our staff to do that, the Latino Community Association. So let's move on to our meeting notes from March. Does everybody feel like those captured a good summary of what happened, what we did together in March?
Yes.
So the way we've been doing this, if you speak up, if you have any concerns, and if not, then we'll consider the meeting notes approved as an accurate representation of what we did together. I noticed there's one highlighted item for follow-up, and it's me. That's the only one I remember seeing anyways. And our advocacy committee has finalized our letter, so I'll get that to the staff to send out to the CAC members and the I think maybe Carmen, you correct me if I'm wrong, with the Health Council Board as well, or maybe the CAC can recommend to the Health Council Board that they support it. But the idea of the letter is to support the full expansion of Healthier Oregon or Oregon Health Plan to all Oregonians starting July 1st. And so the legislature, the law already passed, but the legislature has to appropriate the money to cover that expansion.
I know that this was something we started last year, Brad, so I'm pretty sure the board would be able to support it. But I'll formalize, well, let's talk and we can formalize that.
Okay. All right, so one last chance for any concerns, changes to the notes from our March meeting. Okay. Thanks, everybody. Let's go ahead and move on to our breakout session. Oh, no, sorry. Announcements.
I have some announcements for everyone.
Go for it.
All right, so unfortunately, we ran into some scheduling conflicts for our combined board CAC meeting as well as the social. So they are postponed for now, but we'll send out some more information here in a while once we figure out the details on that. Second announcement is around Teresa Olander. So, after 2.5 years, Teresa Olander has stepped away from the CAC, and she has played a key role in elevating dental and periodontal access issues in the region that also kickstarted our emerging issues process. And she has been a strong advocate and submitted written testimony to the Oregon Health Authority Oral Health Advisory Panel. And so we just wanted to thank her for her commitment to improving health in our region. And
Is that
then
it? Oh, go ahead.
2 more. One quick one. I sent out an email last week and wanted to invite you to participate in the second subgroup meeting to develop the process for the community health projects. I sent out with that email a doodle poll. If you're interested in participating in that subgroup, please fill that out and I can paste it into the chat. And then the last announcement is that we have, the RIP work groups, the Regional Health Improvement Plan, has 2 open requests for proposals. One is around senior food insecurity, developing a metric to track that. And then the second one is around youth engagement and vaping prevention. And we'll put where you can find more information on those grants in the chat.
Thanks, Michaela. What was the doodle poll for again?
The goal is for the subcommittee to work on the community health project process.
Okay.
So once that process is built, then we'll bring it to the full CAC for decisions and everything like that.
Alrighty. Okay. Now we'll go into our breakout sessions. What's our Go ahead, Kelly.
I was just gonna say, so today, we're gonna dive a little deeper into one of our questions that we had talked about last month. And it is, as a CAC member, what does community engagement mean to you? Could mean something different to different people. So we just want you to sort of bounce some ideas and some thoughts within your group. And we'll come back and have a group discussion afterwards. So if somebody could maybe take notes, or if somebody could agree to be that spokesperson for the group, that would be great. We'll give you about, oh, we're actually a little early today, so that's awesome. So we'll give you about 10 minutes or so to discuss, and then we'll come back and discuss as a group. Does anyone have any questions before I send you? So again, the question is, as a CAC member, what does community engagement mean to you? All right, we'll see you in about 10 minutes. Okay, everyone's back. And then just a heads up, Stacy joined us while you all were in the breakout rooms.
Okay, so is the plan to, how many groups do we have? 3, 2, 3?
There were 2 groups for CAC members and then 1 with our support.
Okay, well, let's go ahead and have whoever's going to be the spokesperson for Myra. I think you're going to speak for our group.
Yeah, I
I'll
was
go
in the
to
middle. I was in the middle of volunteering myself when we came back. But yes, I'm like, and then you were gone. So, so in our group, it was Connor and Brad and myself. And for us, I think what we were talking about with what we feel community engagement is really going out into the communities, being part of the community with other community partners maybe, and engaging our consumers, our community members, and getting them to be involved, managing their own care, quality care, and just kind of meeting them where they're at.
All right, and this is Miranda. I've got the next group. We had Tom, Karen, and Elizabeth, and we said, some of the similar things. So building the trust with our community, deepening those relationships, becoming a familiar face, making sure we're equitable, and then engaging the community where they're at. So going out and meeting them, and then hearing from, folks that have what is working and what is not, and then bringing it back to this group and helping address it. We got.
Fantastic. Did the other, thanks everybody, did the staff and everybody else, do you want to report back to?
This is Kristen. We actually kind of took that time to talk about redetermination letters and what they might look like so I can understand them better.
Okay. All right. Well, thanks everybody for talking about community engagement. It is an area that I think we need to put more focus on. And I'd love to see us do more of what we did in Madras, hosting community meetings. And I think one other thing that I would just share as a takeaway or an observation is, we thought about inviting more people, like maybe somebody from Health Council staff, maybe Karen, maybe, somebody else. But just being mindful of keeping like the number of, even though we're consumers too, which is nice, but we're still representing like a committee or advisory council, and having the number of those representing like organizations, agencies being small compared to how many community members you think are going to show up, so that we're not coming in with like 5, 6, 7, Health Council staff, CAC members, board member, and then there's like 5 consumers, or, that balance. I think that's kind of important. And it doesn't mean we don't want to include you, but we just have to be mindful of that kind of ratio. All right. Any other comments? Yeah, go ahead, Carmen. Go ahead.
Yeah, does this meeting ever meet in person at all?
I keep asking that same question. We haven't in a long time, and my understanding is, correct me if I'm wrong, CAC members and staff, but most of the CAC members chose the last time we asked that question to meet virtually. It's just easier for folks and yeah. Is there if anybody has a change of heart about that, please speak up. If you'd like to meet once in person, like maybe our next meeting. Nobody? I know it's challenging across 3 counties. That's our other, it's a big challenge for people to get off work and drive and so on. But if you ever do want to meet in person, I want to meet in person. So if we could ever like find a time, at least once a quarter or once every 6 months or something like that, I think it'd be really good for us. So thanks for the question, Carmen. Any other thoughts before we move on about community engagement? That anybody else wants to share that wasn't part of the CAC member groups? Or response to what we did share? Let's see what's in the chat. Okay, all right. Talkative group today. Let's go ahead and move on with Gwen and Kristen to look at our emerging issues update.
Hi, everyone. So in the last few months around emerging issues, we refreshed on some of the things that you all have brought up to CCO awareness. And one of those was the non-emergency medical transport and some barriers and issues that OHP members are experiencing. We asked Kristen, and she took on the amazing challenge of bringing us back some information with lots of questions that were posed and some data. And so she's going to share with us that today. And then we are going to take some time and have a focused conversation, which just is a conversation to process all the information that she's bringing back to y'all and what that means for us as a group and any next steps. So Kristen, go ahead and take it away. Or does anybody have questions about the background and the context of this agenda item? Don't hesitate, because life's busy and crazy, so please ask. All right, Kristen will take it away, and feel free to put things in the chat as we go along. We'll circle back to them.
Sorry. All right. Do you think Kelly, were we going to share screen? Do you want me to share screen?
What are you more comfortable with?
I have my screen. I have it up in front of me so I can share screen, but I don't have that chart, the scorecard.
Okay.
Oh, maybe it's in the CAC packet, but you might have a more clear, but I'll share screen for the kind of the written answer portion of the exam. I'll share.
And Kristen, to start us off, could you give just a short refresher on what non-emergency medical transport is?
Sure. So non-emergency medical transportation is a benefit for our Oregon Health Plan CCO members. And it would take a member to their appointment, pick them up at their house or where they're living and take them to their appointment and bring them back home. Sometimes there's discretion to maybe stop at a pharmacy on the way back from an appointment. But typically the rides, there's a billable component to it. So the appointment, there has to be a billable appointment to use non-emergency medical transportation. And we have ambulances, stretchers, and just regular kind of taxi cabs, vans, all kinds of different types of vehicles that can transport our members. Okay, so in 2022, Central Oregon they had 101,681 completed non-emergency medical transportation trips. And the average wait time to schedule the ride was 12 seconds. And if that question was looking for a different type of answer, please let me know. But I thought it was possibly the hold time to call Motive Care. So 12-second was the average hold time. And then average wait time for return rides, we don't actually track that right now. But if a member called and said that their driver was late, that would get lodged as a complaint. And then our grievance and appeal team follows up on that. And then distance to an appointment, we also don't track that because we don't limit the distance members can travel through their non-emergency medical transportation to seek the care that they need and want. But if the travel is more than 75 miles one way, that would get reported as like a longer ride. And it might be on the chart that we're going to look at later, but it's not necessarily something that we're tracking right now. I will say though, when I asked these questions, a group of us got together and talked about whether or not these are some of the things that we should be watching and tracking. So I think it was a really good exercise for that group to sort of take a closer look at what the CAC is interested in knowing. So these questions around training, longevity, retention, and background checks. So Motive Care is contractually held to class standards. That's culturally, linguistic. Martha, I forgot the A.
And appropriate services.
Thank you. And Miguel, yes, thank you. And appropriate services. I wanted to say accessible services, but yes, appropriate service. And then Motive Care doesn't actually manage transportation provider staffing. So Motive Care would go to, for example, Ben Cab Company and say, do you want to have a contract with us to provide non-emergency medical transportation? And Ben Cab Company would still be responsible for hiring drivers. So we would have to actually ask each individual cab company to track that information. And to be honest, it's so hard to get drivers and just companies to participate. I think we're a little bit concerned about asking anymore. But that's just where we're at right now. Hopefully things will improve. And then, okay. So all drivers undergo a background check, pass the OIG exclusion check review, and then pass an annual and random drug screens. So I looked up what OIG is, and that's the Office of Inspector General. And these are exclusions from participating in any type of federal healthcare programs because either the person or the business or the practice has been found to pose unacceptable risk to patient safety or program fraud. So if a company has committed some type of fraud against Medicaid or Medicare, they could potentially be on this list and be ineligible to participate in any kind of federal healthcare programs, including TRICARE, which is military. Any questions?
Kristen, I have a couple.
Okay.
Well, one actually up under 5A. The Motive Care is contractually held to class standards. I'm curious about what that means in practice for Motive Care.
They would have to provide the trainings that are approved by Pacific Source and the Oregon Health Authority. But I can ask for more information about what those look like. But it would be an approved training program. And, you know, like any company, they would have to provide some kind of a proof that the trainings were completed. You know, like if we complete a workforce training, usually you get some kind of a score, a certificate at the end.
Okay.
But I can ask more about what that looks like as far as the actual training goes.
Thanks. Go ahead, Brett.
To follow up on that is, so then there's one step removed. They end up contracting with local drivers. Do the local, are the local drivers and those companies held to the class standards?
Yes,
They are.
yes.
Okay.
Okay. So whether or not I think Motive Care is able to provide bus route navigation tips, so they can provide daily and monthly bus passes. So if somebody's, lives really close to a bus route and have a lot of appointments, sometimes they'll offer a monthly bus pass. And they then would also encourage the member to download the Cascades Transit app or visit the website. I heard that they can mail like information. Our customer service could too. But really the most updated information would be using the app when possible. But I thought that could be something we could explore if we wanted to, about just bus routes and things like that. But sounds like right now it's like, here's a bus pass and here's where you find the bus route and information. So whether or not interpreters are provided on the way to an appointment, so they do not supply interpreters for transport. A member could bring a friend or a family member with them. They'd need to let Motive Care know, so they dispatch a vehicle with enough space. Additionally, members could call Pacific Source customer service, who can connect them with a translator through the phone while they're on their travel to and from their appointment. I don't know how well we are letting people know that that's an option. So again, sort of something through this exercise that I learned about, and maybe we can explore. And then trying to match, like, for example, Spanish speaking members with a Spanish speaking driver. So Motive Care would make reasonable efforts, but just due to driving shortages and an effort to get members where they need to be, it's not always possible. Members can request a specific driver, but again, it really is based on the driver's schedule and availability. So they do the best that they can, but it's just unfortunately not a guarantee. And then whether or not the CCO can contract with an organization like Uber Health. And as of now, the Oregon Health Authority prohibits CCOs from contracting with or paying for rideshare services like Uber Health. And the reason is concerns about drivers' insurance, valid license, and background checks, and what that process is through places like Uber Health.
Thanks, Kristen. I have a question on that last bit. It seems like it wouldn't be that difficult to find out what the process is for Uber Health, what their policies are. I'm sure they do all the same stuff. I mean, that's the business they're in, but it should be easy to find out.
We would have to ask OHA.
Yeah.
Because OHA right now is the one setting that rule. But we could inquire about how to perhaps ask them about that.
Maybe Dustin can help us out with that.
Yeah, I'll have to dig into that a little bit more. But great question.
Because we still have shortages, right? Are people having trouble getting rides, or not so much?
Yeah, I think we're still facing a driver shortage for sure.
And I just have one other question, Kristen. So for the bit about being OHP members being able to get set up with an interpreter for as they go on their ride, and Stacy, I see your hand, you're next. As they go on their ride, are your folks letting them know that when they call to, I don't actually know the process. Are they calling Pacific Source to get connected to Motive Care?
So they Well, I mean, if somebody called Pacific Source, we would connect them to Motive Care, but then we would probably, the customer service representative would exit the call as soon as that transfer was made, typically. So I think the question is who's the right person, or who's the right person to provide that information and let people know that that benefit is available. Is
Yeah.
that we're actually going to redo our non-emergency medical transportation flyer this year. So maybe that is something that we could figure out how to add there. But then it also just gets back to the question, are members getting those flyers and seeing them? Are they helpful? Would it be better if we had some kind of a targeted mailing to our Spanish speaking members? But even then, we only have 50% of our members' preferred language data available. It's not something that people always report. And so we could be missing a large amount of people just with that missing piece of information that Pacific Source doesn't have.
Seems like it'd be good for procedurally if the person who is connecting the consumer to Motive Care was the one to say, hey, and do you know if they realize that the person has might prefer to have an interpreter.
Mm-hmm. And I can ask too, like if when Motive Care and when they're actually setting the ride and in their dispatch center, if they have any talking points about that. But to be honest, my guess is no, because when I heard that this was something that members have access to, it was new information to me. And so I do think that it's something that people just don't realize is available to them. So we need to figure out how to let them know. What if the cab, or what if the vehicles even had information in them?
Yeah, or your Spanish speaking customer service folks at least would do this
Mm-hmm.
for the consumers.
Mm-hmm.
Stacy, and then Miguel. Stacy.
If Miguel has something to tag on to what you guys are talking about before I change the subject to something related but not related to what you guys are talking about, go ahead.
Miguel?
Thank you, Stacy. My question was answered. Just listening.
Okay.
So I've been hearing a lot, actually just had a meeting today with the director of community corrections, so like parole and probation, and one of their programs, which is the Drug and Recovery Court. And it was actually around how to transport people from, let's say, being released from jail into a treatment facility. I'm just wondering, what are like the rules or the stipulation? And then I definitely need more, if possible, more information around that. He also expressed that it's really hard to get these services as soon as they are released with their insurance set back up, like convincing people like, no, I promise they're going to have insurance. It's just as soon as we release them, it's not turned on till that point. So I don't know if you have any more information on that you could give me.
Oh, I can. So I was an OHP assister at Bethlehem Inn. When I worked at St. Charles, I would be an OHP assister there one morning a week. And so as of now, the law states when somebody is incarcerated in jail, even if they haven't been like to their trial or anything, they can sit there and they lose their insurance. And they basically have emergency coverage. So if somebody had to be taken to the emergency room, it's called SAIF is what the insurance is called. And it would cover emergencies and treatment in jail. So when when people are released from jail, they have zero coverage and they have to apply for OHP. They have to reapply. Unless they've been incarcerated for less than 30 days, then they could call OHP and provide an update along with a letter from their parole officer, and they would reinstate it. But most people don't do that. And so that's why the Stabilization Center has OHP assisters, Bethlehem Inn has OHP assisters, and things like that. Currently in the legislature, it was a nationwide try to have people in their last maybe 30 days of incarceration be eligible for Medicaid. And that would allow them to set up discharge appointments, have their prescriptions available to fill once they leave, because shocker, you don't get to leave with your medication from jail. That's all kept locked up. So it would allow them that 30 days to make sure everything is set up so when they leave, they're not leaving without any kind of supports, and hopefully they end up at some place like Bethlehem Inn that can help them. So right now that's being debated, I guess, at the state. But again, I think it was one of our Oregon senators that tried to move that bill forward across the entire country, and it didn't go anywhere. But I'm hopeful in Oregon that we could make that happen. So then the other thing that makes it really hard too is when people are first enrolled in Oregon Health Plan, they might be open card before they're assigned to the correct CCO for 30 days. So in Central Oregon, if you're open card, you still call Motive Care and they can still transport you, which is kind of nice. But when they're leaving jail, they're not going to have any kind of medical transportation available to them unless this law passes. And they release people from jail like 4 or 5 o'clock in the morning usually.
Okay. Yeah, I know that there's OHP assisters at the jail now to help do that special form to switch the insurance back on, but it sounds like it might take time for it to actually kick on. So then transportation would be probably impossible, right? And am I getting that right? Okay.
Yeah, their OHP wouldn't be turned on until their feet have left the jail.
Okay. Okay.
Yeah.
Kristen, is there a way to have them apply, but then cover that ride for that service if they did qualify?
They
for
don't. No, not right now, because again, like when you're incarcerated, that SAIF is your coverage. So until whatever happens when you're discharged from jail, until that paper is stamped, you're covered by the jail. So if you were being discharged and slipped and fell and hit your head, and like that hadn't completed, they would still be on the hook. And I can try to find the information about that law that's trying to move forward. But yeah, it's something that I'm glad that there's OHP assisters in at least some of the jails. I don't think it's all of them. But maybe Stacy knows something, I don't know. It's something we talk about though. Yeah, working on it. Like with the community partner outreach program a lot, the OHP assisters, we sort of had something happening and then COVID happened and it all kind of ground to a halt again. But Sean McNulty and Mosaic have been really working hard to provide support to people that are being released from jail. And the stabilization center is also a resource.
Our OHP sisters were doing a little bit of that. I know in Crook County, at least with the jail, trying to provide support, but is that the entirety of what you were going to present, Kristen, or is there more?
Well, we have a bunch of data to look at.
Okay. Okay.
So quarterly, the non-emergency medical transportation providers, which is Motive Care, provide this scorecard, is what we call this. And there's a bunch of other tabs that you guys don't get to see, but it would be all of our member complaints. It would also include driver complaints. Drivers have the right to complain about a member if a member is not a good rider. And so each quarter they submit this information, and our grievance and appeals team, the non-emergency medical transportation provider service representative, and a group of people go through it, and all of the complaints and appeals and all of that. Actually, they receive the complaints and appeals, I think she said every 30 days, but then it's all combined in this report card quarterly. And so you can sort of see all of the different information that Motive Care is tracking and reporting on. So I know some of the questions that came up. Oh, yes, and it's also in the CAC packet on page 8. Kelly, can you scroll down a little bit?
Can I ask a quick question, data question? Sorry, Kelly, could you scroll back up? Because I'm looking at the percentages. So it says percent of total. So there's January, February, March, first quarter total, first quarter average, percent of total. So is the percent of total for like the same day trips 6.5% of the members served, or 6.5% of the enrolled members?
I think it's 6.5% of the rides scheduled were less than 24 hours. And the other 93.5% would be more notice than 24 hours.
Right. And is there somewhere in there, is the total number of rides provided somewhere here that you're
Up
probably
on the very top, number of unique members utilizing transportation.
So that's the unique rides.
Mm-hmm.
Okay.
So that, yeah, so we could have provided 4,000 rides in March, but it would have all been to the same 1,000 members, for example. But then down below, or there's another space where it actually says the total number of rides. But so again, for 2022, the total number of completed rides was 101,681. But that could be the same member, not unique ride. Yeah.
Combined. I'm kind of interested in that, the unique, not the unique member, but each ride, because each ride would have a very different experience, even though it's tied to a member.
Oh, sure.
So I guess that's where I was trying to find, like, the denominator is? The numerator?
Well, the denominator is right below that.
Yeah.
So we had 1,000 members served and the total eligible members was 69,000. Yeah.
All right, thank you.
Yeah. So then, also within this scorecard are things like how many people called and spoke with the Spanish speaking reservation line. So if you scroll down, Kelly, we can look at some of the more language.
Hey, Kristen, I just had a quick question. So is this telling us that there's a relatively small, there's a pretty small number of all the eligible members who are utilizing this multiple times?
Yeah, yeah.
Okay.
But then again, like the 1,000 members that rode in March, it might have been a completely different set of 1,000 unique members that rode in April. I mean, we could probably look at this on a member level, but I can't share it on a member level. So this is kind of as detailed as probably this is going to get. But we could probably run a report and see exactly which members have utilized medical transportation.
Yeah, it's not important to know the actual members, but like an unduplicated number of members, it seems like an important number.
Okay, so let's see at the very end. Kelly, can you scroll back up? Number of unique members utilizing transportation. Yeah, I guess it doesn't say, it just says the year to date would be 1,089. So I can ask for clarification and say, is it only 1,089 unique members or is that the average? So I'll follow up on that and ask what that actually means. Yeah, I'll follow up on that.
Thanks. And you're going to scroll down and look at some other.
Yeah, and I'm looking at it over here on my screen too. So right before you get to the next page, Kelly, it talks about the different calls that have been received. So measures number of reservation calls received, numbers in the English queue and Spanish queue. So you can see there that, the majority of people calling in to schedule a ride are English speaking members. And in Central Oregon, those are the languages we would track. We don't have enough members speaking other languages in Central Oregon. If it's under 10, we don't provide the information. It'd be too easy to identify somebody.
Yeah, so it seems like an important question, like whether or not our Spanish speaking members actually know about this benefit.
Mm-hmm.
They need it less, or do they just not know about it? So I'm not
Mhm.
sure how we figure that out, but
And I have a question. Sorry, I stepped away for a little bit, but came back and it was very interesting. Is this transportation that the members themselves provide and get refunded on or reimbursed?
We track that too.
Okay.
So now I have to find it though. Oh, I could have sworn we tracked that. Oh, shoot. Let's see. I thought I saw a section where it talked about also members using meal stipends in hotels someplace, and it would have fallen into that. Oh, trips booked for lodging or meals. Oh, maybe we only track that. I thought it would have gone into that as well. Under trip mode, kind of right before you get to the second page, it talks about the different types of transportation or vehicles. So sedan, transport wheelchair. So public transportation would be bus passes, and it looks like there is 0. A stretcher would be for somebody who perhaps needed even a paramedic with them during their transport, if they're on maybe oxygen or something like that. Like trach, like a ventilator oxygen, not just, the type that you can take with you. And then below that would be the trips booked for lodging and meals. And I thought that would also include people driving themselves, but it doesn't. So I can ask about that too. How many members are asking for reimbursement for mileage?
Mm-hmm. And what the process would be for them to get reimbursement, and like what the time frame would be for them to get reimbursed, and how accessible is it to them?
I know all of that. So they have to fill out a form. And so first off, they have to call and get approval to drive themselves.
Okay.
So you would call Motive Care and let them know I plan to transport myself to Portland for this appointment. And then when you go to Portland, you would take a paper with you, a form, and you would put, the starting address, the finishing address, and then the provider would initial or sign the form. And then there's, I think, 45 days to submit that then to Motive Care to be reimbursed.
Okay, thank you.
And I'm happy to share the mileage reimbursement forms, and there's also meal and lodging. I'm happy to share those forms and they can be shared out
that would be great.
Okay, and we have them in English and Spanish.
Awesome. Thank you, Kristen.
Is there any sense of what the turnaround time for that reimbursement is for folks coming from Motive Care?
I'm not exactly sure, but I can ask. And sometimes in certain situations, they're able to preload. It's like a debit card that they would put this onto. In certain situations, I've seen people be able to advocate enough to get like money preloaded, but I haven't been working alongside our members in my, like I did in my old capacity, to know if Motive Care is offering that type of flexibility. But when it was Cascade East Ride Center, they would sometimes allow that. And that's the beauty of having like a local place that just can offer that. But I can ask about that too. Like if, you know, a family has to spend the night and they don't have the money to pay for the hotel up front, what are they going to do? Flex funds would pay for it.
Great questions, everybody. Is there anything else, Kristen, in your presentation or your?
Oh, I see there's some chats. Okay, I will, yep, I will get the reimbursement forms. That was it for, oh, the only other thing I was going to mention, which is also in the CAC packet, is currently we have some transformation quality strategy projects that are focused on non-emergency medical transportation and on oral health integration. So I put those activities here. It is very it's very technically written. It's kind of hard to even for me to exactly understand. But if we wanted to have one of our TQS teammates come to a future CAC meeting to talk about these activities and what this actually means, we can ask somebody to come. But I do know that one of the activities is asking our non-emergency transportation providers to survey members to find out if they know about the free transportation services available, and with the goal to reduce the response rates of no. And then there's a certain percent that we're hoping to move to. Again, it's very technical report. But it does sound like we're trying to figure out just basic information about whether or not people know about this benefit. And also just a goal to reduce complaints. It's our largest complaint is around non-emergency medical transportation. And then since we continue to talk a little bit about oral health, here are the oral health integration strategies that are currently being worked on. They are somewhat related to diabetic members, but the hope is that if we can improve access for one group, it improves access for all, which is typically the trends we see. And so efforts to get the DCOs, the dental care organizations, to use Care Oregon for referrals and promoting teledentistry and oral health screenings within primary care offices. So that's also in the CAC packet if you want, or I'm sorry, we can send it out after this meeting. I didn't have it done in time. And if we want to learn more at a future meeting, I can have one of my TQS teammates come. But that's it for me. Thanks for all of your time today. Wow.
You did a fantastic job right up until the end there, Kristen. What's TQS?
Transformation quality strategy.
Okay.
Yeah. Oh, we have PIP, provider improvement projects. Oh, it's all the acronyms.
Thank you. Oh, somebody.
Real quick,
Go ahead, Stacey.
it's not super productive comment, but I really think we should take all of our acronyms, and when we all get together for like that social hour thing, we should play a game like bingo. Whoever can guess all the acronyms from all the different organizations, even if they're the same, like CAC or like PNP is like policy and procedure to health department, but to public safety, it's parole and probation. I'm just saying this could be fun.
And then we can make up some new ones too.
And
Like,
the prize,
like ED.
yeah,
An acronym dictionary.
yeah. And everybody can have their own section though, but the prize will be just everybody's respect and maybe a little tiny trophy. Like tiny.
All right, everybody remember that idea. Anything else, Gwen?
Yeah, well, I don't, but what we have next lined up, based on the agenda, and Brad, I look to you, is that we kind of do some processing as a group to see what we've learned, what stood out, and move us towards conversation about what might be the next steps on what we heard.
You want to do that now?
Yes, if we have time. How are we doing on time?
It just depends. How much time do you need, Dustin?
Super quick, but if you want to, it's a slide deck and it's very wordy with links to information. I'm happy to just send that out and then you guys can read it that way too, whichever works. There's lots of information in it, but that's fine.
Is there?
Take the time. I'm fine.
Okay. Sure. All right. Is everybody okay with that?
So I'm thinking we have 10 minutes left, so it may be better use of that 10 minutes for Dustin, you to share out, because I don't know how we'll be able to get into very much depth in 10 minutes for processing the information. And I know, Kristen, we gave you a lot of questions that you've been gracious enough to bring back with us. So maybe that's the first step.
And I can try to get those questions before the next CAC, and then maybe if the PDF I sent yesterday, and then people have a little bit of time to think about it. Now I feel bad I took all the time up.
It was good. We got lots of questions. No, there was a lot of good conversation embedded in it. What do you think about, and I can put some of the conversation questions so people kind of know like what the follow-up conversation might look like later.
How does everybody feel about that? Any objections? You can't object. It's okay to object. All right. Yeah, I think we're going to be crunched for time, probably either way. So if we try to process it, we'll probably be crunched for time. And if we, not either way, Dustin's going to have plenty of time. But
Okay.
All right, we'll do that. So we'll follow. Everybody think about it, and we'll come back together the next meeting or in between through email. And you can always shoot information to Gwen and Kristen. Go ahead, Dustin.
All right. I'll go ahead and let me see here. Is that working? You're able to see it? Perfect. Okay. So here's your update from me. You have all this information. Note the new email address, but feel free to text or call if you have any other questions. So let's see, I just need to hide this for a second. So there were questions around food benefits that were coming up. So wanted to make sure that you had information on the EBT, pandemic EBT money for children whose access to food may have been impacted. So this is something that will be available to children under 6 who received SNAP in summer of 2022. So just wanted to make sure that you have that information. There are other resources. There will be a letter in the mail before receiving the benefit. That's about $389,000 throughout the state. So if you have any questions about that, you have this information here. Medicaid program updates. This is something that we missed, but they should be available in both Spanish and English. If you go to these links, they are recorded, and then those are all kind of kept on the Medicaid waiver stuff too. So we've been trying to give you lots of updates, but this is just something that's a resource that you can go find. The key components helping to meet social needs of members going through life transitions and starting in January of next year. Children automatically enrolled through 6th birthday, 2 continuous years of eligibility, some expanded benefits started in January 1st of this year, EPSDT. And let's see if I get the acronym right, like early prevention, screening, and development. So Chip Learning Collaborative updates. So there's a webinar for tribal engagement that was in March. And so those recordings and slides and handouts are all available via these links. So I just wanted to make sure that you have these resources. And there's another Learning Collaborative session coming May 4th. And here are those links to register. It's on health equity data, sustainability and dissemination of information. And then if there are other accommodations that you need, you can also just write to Tom Cogwell at the Transformation Center, or let me know if you're interested, and we'll just make sure that they get that data.
Hey, Dustin, what is
Yes.
Cha and Chip? What is Cha and Chip?
Community Health Assessment and Community Health Improvement Plan.
Yeah, I found that confusing since we use raw and rip.
Yeah. Oh, yeah.
I mean, it's not confusing, but it's not.
We're the only ones that use raw and rip. Everybody else uses those.
Yep. Have to be regional, and you took that to heart. I think that's great. So let's see here. Am I not advancing? So the Ombuds program report for 2022 is now available, and there's a website there. And you know, they're required in statute to provide a summary of the services that they provided, recommendations for improving access. So as we talked about previously, I think you will see non-emergent medical transportation show up in that report, as it's always been kind of an issue. And then recommendations for improving Ombuds services. So just wanted to make sure that you have that report available. And
Hey,
also,
Dustin, I have
yeah.
to bother you again, sorry.
Yeah.
Please take this up the chain of command to get rid of this word ombuds. Where the heck does that come from?
I think
Is that
it's
like 15th century or something. I mean, what is ombudsman?
I think that it's let's see if I get this right. It is the I think it's Swedish. So we use ombudsperson now, and I believe it means advocate of the people. So that's really
Let's use advocate of the people.
I mean, and we have lots of different ombuds programs too in the state. So and then this is just some information around 988, you know, the crisis lifeline. And then those specific at the bottom, you'll see the different like chain selections of veterans crisis or LGBTQIA2S+, or Spanish specific. So just want to make sure that you have these as reference. And then affordable connectivity to broadband is something that's, you know, come up in specifically in rural areas. So just want to make sure that you have steps to enroll. So that's affordableconnectivity.gov to submit an application. And you've probably never heard this before, but we're starting redeterminations for Medicaid. So again, here's some information for you and some links if you have any questions. And then mail will be coming if it's time to have yourself or family members redetermined. And here are some other resources for you. So I will just make sure that we get this to the Health Council, and you can just use those. So just wanted to make sure that you had that stuff. Any questions? Perfect. With 2 minutes to spare.
I have one quick question. Back to that 988 suicide and crisis hotline. What's included in crisis? Like, is it all related to suicide, or is it broad? How broad is that?
Broad.
Okay. So basically anybody who needs help from someone outside their, yeah.
Can I offer
Okay.
some feedback for the 988 from the Veterans Director in Crook before he left? Was he was dealing with quite a bit of personal calls, because when calling 988, they're being met with like the press 2, press whatever. And so he struggled a lot with that, and people ended up not wanting to use it. I just wanted to share that. He ended up having quite a bit of calls a week.
Okay. Yeah, that's super helpful. I can take that back to the team.
Excellent. Any other comments? Anything anybody wants to share before we go our separate ways. Following our promise to each other, Connor, Karen,
Nothing from
Myra,
me.
is Myra still with us? Are these people still with us? Connor's still with us. Did you say
Yes,
nothing?
here.
Nothing from me.
Nope,
Nope.
I'm good.
Anybody else?
Just a note that we also have a local crisis number that serves Central Oregon, so I can provide all that information to Kelly as well. I'm pretty sure we have it all in one place.
All righty. Well, thanks, everybody. Another great meeting. Thanks for
Thanks,
being here.
everyone.
Thank you.
Thank you. Bye.
Bye.
See y'all later.